everybody. I'm Dr. S.K. Khanna, speaking from Chandigarh. I'm a practicing primarily a family physician, looking after mostly elderly subgroup of patients. We are in Chandigarh. I'm in the practice for the last about 35 years, having served the government uh, posts for about 10 years. Dear friends, everybody who's around, I'd like to talk about a very common problem which is afflicting our large part of society, and that happens to be hypertension. In a common man's language, we talk of it as a raised blood pressure level. Basically, when we talk of the raised blood pressure or the hypertension, we are talking of a thing which probably is normal as well as abnormal. Normal how? Everybody is going to, at some stage or the other, end up having blood pressure. Uh, well, except some people who make it a point and take care that they do not get affected by the raised blood pressure. Why? Why does it happen that everybody is going to get it? When I say that, I mean I'm talking of something like people as we progress in the age, our blood pressure keeps on increasing. That's because our blood vessels get stiffened, they become stiff. And first of all, what is blood pressure? Blood pressure, every time the heart beats, it is the pressure exerted by the blood on the walls of the arteries. So this is what is called the blood pressure. Absolute normal happens to be 120 upon 80, but then we have some parameters which keep on over a period of time defining what is a high blood pressure. Presently, it is interpreted at about 135 upon 85. Now, going back to the causes of blood pressure, yes, as we progressively age, our arteries become stiff and narrow, and this causes the pressure to be raised. Number two, family history. If we have a family history of a close family history, that is father, mother, brothers, sisters, if any one of them or the close members have blood pressure, chances of people developing is high. People who take excess salt. Now, when we talk of the salt, we are just simply talking about ordinary table salt. We are overlooking that as of the today's young group of children who are consuming lots of pre-cooked food outside in the market, like bread, pastas, and all these are loaded with the sodium bicarbonate. These are loaded with the salt, and this we don't end up counting. We just keep on counting the salt, which is conventional salt that we take. Then we are not eating enough of potassium-rich food, can increase the blood pressure. Again, going back, processed food, which is fatty food, it also increases the blood pressure, and it makes the work harder. Another one of the reasons is the stress. Stress is a very complex process, how everyday stress on our mind increases the blood pressure. This increases through stress hormone, which is produced by the gland on the kidney, adrenal gland. So it doesn't have any obvious signs and symptoms. As a blood pressure, most of the people don't even know. And this is what makes it a silent killer. The sudden deaths, the sudden paralysis, the sudden loss of vision in the eye, lot many things. The damage could be profound and large in the form of the kidney failure, in the form of the stroke, or even in the form of the eye damage and blindness and all that. Hence, it is very pertinent and important that a early diagnosis is done. How do we do that? Well, yes, every time you go to the doctor, once you're 25, it will be, I think, very pertinent for you to ask your doctor to look up your blood pressure. There may be very mild or sometimes symptoms some people report, which may include, morning headaches, tiredness, slightly at times vision disturbances, fatigue, nausea, vomiting. They may be the blood pressure signs, symptoms. But again, generally speaking, it is more sensible. Most of the blood pressure patients are they come through with the doctor. It is on the routine examination only. So when we talk of that, I think again making a adjusting for the present day stress levels and all that, any reading above 140 upon 90 should be treated there and then only. It has to be labeled as hypertension, and patient may or the people may ask their doctor, "Ki doctor, please go ahead and start the medicines." Because subconscious tendencies, no, this may be an offhand reading, so I think I'll not rather start a medicine. I think it is more proper to ask a doctor to start a medicine rather than asking him not to start it. What best can we do besides the medicine as a patient who keep asking us, "Ki doctor, medicine is one fine thing, but how do I prevent this? How do I prevent its progression?" Well, yes, it is very possible if only we adapt few things. Talking of that, we talk of first of all regular exercise. Regular and physical exercises are very important. And when we talk of these exercises, we are talking of age adjusted exercise. Age adjusted exercise means, well, you should go for a walk, maybe you do a little aerobic exercise, maybe you do a little yoga at home. When we are talking of age adjusted exercise, very simple thumb rule is that if you are going for a walk, you should be able to talk with someone who's walking next to you, but should not be comfortable in singing. So that's the level at which you got to walk. At that level, you're doing the exercise which is good for the cardiovascular system, that is heart, blood pressure, and these symptoms. Next, we come down to the healthy diet. Healthy diet means, well, a lot of things have been written about the healthy diet, but thumb rule is eat less of salt, eat less of saturated and total fats again, and take lots of potassium. And then there's another thing which is called dash diet, dash plan. Dash plan talks of eating lots of green leafy vegetables, taking fruits, and for the non-vegetarian patients, taking a regular amount of fish. This is otherwise as well as called as Mediterranean diet. So dash diet is something which is very healthy for the body, and it should be rich in grains, fruits, vegetables, and a very low fat diet, fat dairy production. Reduce the next salt levels. The salt levels have to be reduced to something like about 1 teaspoonful for the whole day. Teaspoonful translates to something like about 2300, 2500 milligram of sodium per day. Anything above that, well, no, 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 should be avoided. Excuse me. Next important thing is those all who are smokers, they must make a charter out a plan to quit smoking. If not immediately, they should make an attempt to quit it over a period of time. Taking help of nicotine gums is okay, but nothing like your resolve. It is best to just stop it one day and that's it. Get done over with it. The next is, once having done all these things, we go for a prescription of the medicine, we start the medicine, and then we forget it. No, be regular with your visits to the doctor, get your blood pressure monitored regularly. This is very important because time to time the modalities, the newer drugs, and addition or reduction in the doses is what your doctor will be able to offer to you. Then comes the present day's very important thing, that is stress management. Very individualized things. A doctor, for him, it is so easy to say, "Go ahead, just reduce your stress." How do we end up reducing our stress in a life which offers you stress from the morning alarm set in your phone to in the night when you sleep, which is late nights, very difficult. But again, the thumb rule is the lighter you, the simpler you keep your lifestyle, the better it is. You know, think of your body primarily first. You are healthy, everything around you will be good. You're not healthy, nothing around you will be good. So stress in the work, stress in your relation with your elders, stress in relation with your people, stress at office, stress at home, stress at work, reduce it. Very big cause of the blood pressure as of today, as in these days. Then sticking to the medicine. Please do not, every time a doctor prescribes a medicine, patient goes to the chemist and patient discusses the chemist all the things. Chemist has lot many newer drugs to offer advice to you. Please do not. Your chemist is just dispensing medicines to you. Your chemist is not your doctor. Your doctor, however little time he could have given to you, and whatever long talks you can have with your chemist, still your doctor remains a very, very well read and a highly qualified person. He knows best medicine for you because he would be thinking of your kidneys, your family history of diabetes, your history of any sudden loss of vision in your family. He would know all these things. Having a thought of those things, he would be prescribing you a medicine which would be best and tailor made for your blood pressure. So please stick to the medicine, please stick to the doctor's advice, and please stick to the doctor. Don't keep changing, looking for magic things. I think this is what I have to advise. Beyond that, there are not many other things left which need to be done. Yes, and we be vigilant about any untoward thing happening within your body, and feel free to immediately report to your doctor. And sudden sweatings at odd hours, yes, need to be reported to your doctor. Any sudden alteration in your vision, yes, it needs to be reported to your doctor. So I think that should be it. Uh, Take care of your health. Be vigilant about your silent killer. Let's make the nation healthy. Thank you. Thank you, everybody.